Labor is a really hard process for most people, but some of us also have to deal with back labor, or intense back pain while in labor. Most of the time, you won't feel too much pain until active labor, when your cervix has already opened up about 3 centimeters. Back labor can happen to anyone, but it's more common when your baby is face up. It's sometimes called a sunny side up baby. Even though it might be painful, there are positions that can help. Some of them help your baby move so he or she is facing towards your back. All of them move your baby off your backbone to decrease the pain you feel. Let's look at some of the ways you can make back labor feel better.
We'll start off with some standing positions.
If you have a partner, a doula, or a friend with you, you can try slow dancing. Rocking back and forth can feel good and also helps your baby to move in your pelvis. The dangle is also a move you can do with a partner or support person. If you don't have anyone with you, or if they get tired, you can put your arms on 2 tall stools or counters instead. Doing a lunge to the side might also feel good. This is also a good way to let your baby move to a new position. Pressure on your back can also help with back labor. For this position, a support person will hold one hand on the front of your hip and push on your low back with the other hand. They can move their hands until the pressure feels good to you. The double hip squeeze helps open the bottom of your pelvis. If you have 2 support people, one can press on each of your hip bones. Next, let's move on to some sitting and squatting positions. You can sit backwards into a chair so you can lean forward onto the back. This is a great way to sit so that a support person can rub your back. There are a few ways to have a support person help you squat. If you hold their hands, it's easy to sway back and forth. With a support person behind you, you can relax more, but your arms might get numb. It can help to put a pillow or towel under your arms. A lap squat might feel better on your knees and ankles. It's good to have another person behind your partner so you don't fall. Next, we'll talk about some kneeling and lying positions. You can get onto your knees and lean forward onto a chair, bed, birth ball, or the side of a bathtub. This can help your baby change positions. You can also help your baby move if you get onto your hands and knees. This position puts a little more stress on your wrists, but many people find it really helpful. The open knee chest position can help your baby move in your pelvis in early labor. Don't use it if you want to keep labor moving quickly, because gravity can't help move your baby down. Side lying will also not help your baby come down, but it's a good way to take a break. Put a pillow, blanket, or towel in between your knees to open your pelvis. You can also have a support person hold your top knee. It's a good idea to practice before labor starts so you can get used to these movements.
Thanks for watching!